How would you feel if your doctor told you that you only had months to live, unless you received a heart transplant? Now you would be placed on a waiting list along with many others who are in need of a new heart. Can you imagine what it would be like to be handed a death sentence, but to know that your life could be saved by anyone if they stepped up and became an organ donor? Today, I will be discussing the topic of organ donation, with information on who can be a donor, why you should become a donor, as well as some of the myths associated with it. As a registered organ donor myself, it is the easiest thing that you could ever do to save the lives of other people. I will also give you some places where you can register to become a donor today. Organ donation is a way to save lives. No matter how old or how young you are, you can become a donor. According to organdonor.gov, over 100,000 men, women, and children are on an organ donor registry list right now. And another person gets added to that list every 8 minutes. According to the same source, 13 people die every day waiting for organ transplants, but one organ donor can save up to 8 people. Anyone can become an organ donor, and very few medical conditions disqualify you from being one. Even if one of your organs is deemed invalid due to disease, there's a good chance that at least one of your other organs can save someone's life. Some of the reasons that someone couldn't become a donor include being HIV positive, having a systemic infection, or having active cancers. When an organ is needed, the patient is placed on a waiting list, where they wait months or even years for the organ that they need. Where the patient is placed on the list depends on who has better chances for survival, as well as who needs the organ the most. According to the United Network for Organ Sharing, different factors that affect organ compatibility for patients include, but are not limited to, blood type, body or patient size, tissue type, medical urgency, and geographical proximity. Factors such as race, gender, income, age, or celebrity status are not considered in the distribution process. Now that you know how many people are placed on the waiting list and how they are placed on that waiting list, let's look at what organs are able to be donated. Major organs that can be donated include the heart, lungs, liver, pancreas, intestines, and kidneys. Other parts that can be donated are skin, bone, tendons, cornea, and even hands. While organ donation is a vital treatment for many people with kidney failure, heart disease, lung disease, and cirrhosis of the liver, most of the time it is the last choice of treatment for these patients. Now that you know what organs can be donated, here are some ways to take action and save lives. The first place that you can sign up is the DMV, where you get your license. All you have to do is ask to be an organ donor, and a small red heart will be added at the bottom of your license. You can also register online through the donatelife.org website, which gives you the option to join the donor registry at the state or national levels. Everything pertaining to organ donation is your choice. That means that if you are uncomfortable donating some of your organs, you can only donate specific ones. A myth that goes along with organ donation is that if you are a registered organ donor who is admitted to the hospital for an emergency, doctors may not do everything to save your life. This is completely false. Doctors and medical emergency staff will always prioritize providing life-saving care, regardless of the patient's donor status. This myth is often believed due to media and entertainment programs conveying a false narrative of organ donation. From a 2007 research study titled The Framing of Organ Donation in Entertainment Television, Dr. Susan E. Morgan writes, "People who did not favor organ donation frequently cited what they had seen on television as evidence for their negative opinions." Before I conclude the speech, I want to provide a true story of a life that was saved due to organ donation. On the donatelife.net website, there is a tab titled Stories of Hope. These stories provide real testimonies of the lives that organ donation saves each year. One of these stories is of a young girl, Amaya. Amaya was born with a heart defect called hypoplastic left heart syndrome, which meant that the left side of her heart was not fully developed, and her blood flow was hindered due to this. At just 6 days old, she had to undergo heart surgery. However, her condition did not improve. If Amaya did not receive a new heart, she was going to die. At 5 months old, Amaya was placed on the National Organ Transplant waiting list, and 3 months later, she received the heart that she desperately needed. The transplant surgery was a success, and after spending the first 10 months of her life in the hospital, Amaya was able to go home for the very first time. 7 years after her transplant, Amaya is living as a kid just as any of us did. Amaya's mother stated, "Organ donation saves lives. My daughter is proof of that." Each and every one of us have loved people in our lives. People that we rely on, people who support us, people who provide for us, people who help us get through the day. I know that it can be uncomfortable or even scary to think of someone living with our organs. But that is a life saved, a life that otherwise would have ended. But organ donation isn't just about saving one life. It is about affecting multiple people's lives. It touches the lives of everyone associated with the person. Friends, family, classmates, and coworkers are all able to have more time with each other from your decision. Have a heart and save a life.